Sabah Al-Ahmad Urology Center was established in 2013 by order of His Highness the late Emir of Kuwait, Sheikh Sabah Al-Ahmad Al-Jaber Al-Sabah. What makes the center unique is that it is the only center in Kuwait and the region dedicated completely for urological care. So we have units in uro-oncology, pediatric urology, infertility, andrology, endourology, reconstructive urology, and others. In addition, what also makes our center unique is that it is the only center in Kuwait to have the latest technology used in surgical practice. So we have multiple types of lasers, such as the holmium laser, the microscope to perform microsurgical procedures, and last but not least, the Da Vinci SI robot. The first series of radical robotic prostatectomy in the Gulf region came out from our center, published in the Journal of Robotic Surgery in May 2020. And we published the first multi-institutional series looking at outcomes of radical robotic prostatectomy in the Middle East, published in the Journal of Endourology in February 2021.
My role in the center is I assess patients with complex stone disease. We get a lot of referrals from different centers within Kuwait for complicated, difficult stone disease. We have an extensive battery of testing we do, being it radiology, nuclear, comprehensive lab, and all the amenities for performing all kinds of stone management, being it medical, non-invasive, minimal invasive, flexible ureteroscopy, mini PCNL, together with laparoscopic and robotic. And this is all utilized in managing these complex patients.
I'm a consultant urologist with a special interest in female and functional urology, in uro-urology and andrology. Now there are quite a few surgeries that we do in the center. For example, the transobturator tape or transvaginal tape insertion, facial sling insertion, rectocele and cystocele repair. Also, we do different kind of fistulas and urethral bulking agents. I have established the pelvic neuromodulation service in the center, and currently we are one of the first centers regionally to use the MRI safe system, and now we have about 100 patients and counting that were implanted.
My job is dealing with reconstructive cases such urethral stricture, hypospadias, fistula, and so. Since 2016, I established the first urology reconstructive center in Kuwait. Before that, nobody was doing such surgery. Genitourinary reconstructive treatment, including augmentation, urethroplasty, excision and primary anastomosis, treatment of pelvic fracture urethral injury, treatment of hypospadias, fistula before the year 2014 were sent abroad. When I came and joined Sabah Al-Ahmad, we established our center, so most of the cases now treated here in Sabah Al-Ahmad.
My role in the center is dedicated to male infertility and sexual dysfunction. We provide a full healthcare system catering male infertility and sexual dysfunction that is one of the kind in the country. We have top-of-the-line investigation facilities that provide the best outcome for the patients. We also provide hormonal treatment and investigation. We also genetic counseling and genetic testing and all variety of radiologic examination. We utilize the latest top-of-the-line microscopic surgery for our andrology surgery, like microscopic varicocelectomy, microscopic vasovasostomy, and microscopic testicular sperm extraction to provide the best complete infertility treatment for the couple.
We have a well-developed uro-oncology service accepting referrals from all areas in Kuwait, together with neighboring countries. We collaborate locally with our radiation and medical oncologists at Kuwait Cancer Control Center to provide a multidisciplinary approach type of management for our cancer patients. In addition, we collaborate internationally with cancer centers in research projects and in training our residents and urologists as part of an exchange visitor professor program. The residents rotate in multiple clinical sites, totaling to 7 sites. However, what makes our center as home to Kuwait's urology residency is the fact that the faculty members in the residency program all work in the center, having direct supervision and evaluation and training of residents within our center. We have high exposure for residents in our center. For example, in 2021, there were more than 2,270 surgical procedures performed. So our residents are actively involved in the operating room, in outpatient clinics, and in rounds and in research projects. We involve them in robotic training, so we gradually introduce them into robotic surgery, first through simulation training, then doing online courses, then docking and bedside assisting, and then supervised console training in real cases.
The Kuwait Urology Residency Program is very active in terms of research. We have many of our residents presenting their studies in local, regional and international meetings. We had also publications in world-renowned journals.
Our goal and our mission is to help patients, support doctors to help patients, and improve urological care through research. We look to recruit qualified urologists to be involved in local and international research projects, to train our urologists in the residency program to become better urologists, fully qualified and independent, and to try and innovate and bring more technology that comes back for the benefit of the patient.